Dear friends, today we'll discuss about one most important drug in homeopathy, that is Arsenicum Album. Here in the arsenic, what we see, actually, if we see a person as a whole, any individual, we want to see the actual picture of an individual. We can divide that individual in three different cores. First is innermost core is his mind. Second is his emotional state. Third is our physical body. Actually, in our naked eye, we see a person, his physically, but inner core is his mind. Actually, what we think or we believe, we become. That is the most important thing we have to remember. So, in our mental state, in our mind, what we think and we believe, we become. That is the most important part in homeopathy. Because most of the medicines are selected on the base of mental symptoms. Unless we don't get the essence of mind of a particular individual, it is very difficult to select a drug, single drug. That is the reason most of the physician, they cannot get the essence of mind, how the things are, there is a evolution. Actually, what we think, if we think in a positive way, two things are there which increase our defense mechanism. That is, if we stay in joy, happiness and love to everybody. This is positive state. And negative state, there are so many things: anxiety, anger, hatred, and enviness, haughtiness, egoistic. These all are negative. And this positive and negative in our mental state, when it is growing, if our positive state is going, then our immune system or defense system also good. In case of arsenicum, what is happening? Arsenicum patient, they are always in fear. In their deep core of mental symptoms, we see the fear. And what is the fear? Fear of dying or fear of death. That is a prime thing in case of arsenicum. And there is, why this fear is coming? What is the origin of that fear? The origin of the fear is, it is because of insecurity. It is because of insecurity. The fear is coming. And this is the key manifestation. And because of this fear, they become vulnerable. They become vulnerable. And because of this, because of this insecurity, what is happening? They are getting vulnerable to this hostile world and they become defenseless. And this defenseless, what is happening? Because of this defenseless, they goes to person to person. They likes company. So arsenic album is specially a selfish drug. They are, by birth, they are selfish. And this selfishness is coming because of insecurity. And this insecurity grows the fear, and fear of death, they will die. That is the main keynote of arsenicum. Actually, if we divide arsenic in two parts of our life, of an arsenic patient, or particularly an individual, in two parts. One is older and child. Old person, above 50, 60, and children, generally little children, and middle age. Actually, middle age people, young age, middle age, they are physically strong. But in case of older and especially the child, they are very much weaker physically. And because of this weakness, there grows some insecurity. And because of this insecurity, they show different manifestation. And in case of old age, what is happening? Because of this insecurity, they are growing the a desire of company, desire for company. There is a desire for company. But in case of middle age or the strong person, there is a possessiveness, and they love money, power, and they want to be possessive. Internally, they are insecure, and because of this possessiveness, they possessive about different objects, about money, and they are always a taker. Ultimately, it makes them a selfish remedy, because they are always thinking about their money, their own physical body, if anything is happening. So, arsenic is a avarice remedy. They are very much miser. They are always a taker. Suppose arsenic is spending money anywhere, before that they are thinking how much I will get back from there. This is the deep thinking in their mind. They are always how much returns he should get. And arsenic is always a fastidious remedy. Fastidious, always he wants neat and clean. That fastidiousness is also growing because there is an insecurity of their health. They fear about the microbes, different bacteria, virus. Always they are searching if anything is happening. There is a always fastidiousness, microphobia, constant washing their hands and all the things, because especially this time we can see there are so many people, they are washing hand because of instruction, but in case of arsenic it is coming automatically. They are always washing their hand. I have seen a patient, I have seen one patient I was having, mentally he was ill. Her husband was telling that whenever I am coming from market, I used to take bath from outside. I cannot get inside in my home. So this is the arsenic. I gave her arsenic 10 ml, one dose, and that lady got all right. So fastidiousness is like that. There always anxiety. There is anxiety, always anxiety about their health. And he is afraid that he will die. And day and night he is thinking that something I have to do. So arsenic, anxiety we can see in different drugs. We can see in calcarea carb anxiety, calicarb, and phosphorus, calcium, acid nitric, lycopodium. There are many drugs are there. They are having main anxiety, the different types of anxiety. In repertory, if you see anxiety, there are so many drugs are there. But in case of repertory, it is very difficult to interpret the anxiety, what type of anxiety he is having. Uh, but we should interpret, we should know that what type of anxiety a person should have. Then only repertory is useful. Like carriers, their anxiety, they are having anxiety about their heart. Then so phosphorus, they are having anxiety for all. In case of arsenic, they are having anxiety only for their nearer one, her son, own person, and her own body, because arsenic is a selfish remedy. Okay, so in case of constitution, if you see the constitution of arsenic, Catherine Arkulter has given a very good example of arsenic, that he is telling arsenic is like a racehorse. He is irritable type. Racehorse, you have seen the racehorse. What he is doing before race, what he is doing, always irritable. And irritability, how it is coming? It is mental irritability. Arsenic is having a mental irritability, and it because of nervousness and extreme sensitive arsenic patient. They are very much sensitive, perspiring easily and profusely. Perspiration is there when they are restless. So when there is a despairing of life, they travels from doctor to doctor. If any disease, if they are having, they are going from doctor to doctor. They will get for checkup to, they will go different types of doctor. They go for allopathy, they go for homeopathy, they go for Ayurveda, yoga, everywhere, nutritionist. If any problem is coming, and they are very much positive to their health, they very much positive. In case of in some treatment, we are giving arsenic. We start with arsenic. If somebody is coming after so many means from different medication, we also give them arsenic to clear the extracellular fluid. Arsenic works very good. And so arsenic is how the pathology develop in arsenic. First, they will very much first stage of any disease, they are very much fastidious. Fastidious means they always neat and clean, always everything, there is nothing is there. If something they are seeing, my goodness, they always keep it clean. Okay, after cleaning, I will do this thing, that thing, and I will get clear. Then their anxiety grows, and he goes for different doctors, for different testing. There is a fastidiousness, stinginess. In second stage, what is happening? There is an increased insecurity. He is thinking what will happen, and for that arsenic spending lot of money because of his health. But he is generally is a miser. He will not give one penny to anybody. He don't want to spend. If he at all gives anything to anybody, then first thing he will, there is a internal thinking in his mind that how much I should get back from that person is spending money. Just think, because of his health, he will go here, He will go there, so many doctors, he's possessive. That there is a fear of his dying, anguish of death, and there is a anxiety of fear, and that time he becomes fear to being alone and fear of death, and gradually that fear become obsessive and anguishing fear. Means, so there is a anguishing fear. So unless that pathology is solved, if any pathology goes to arsenic, and arsenic is one of the, I have seen, their complaints never ends. Their complaints never ends. If if you solve the one problem, then they will come with another problem. They will say, no, this thing is not all right. You have solved my this problem, but that thing is not all right. So they will be continuing the treatment. That is there. And in case of treatment, arsenic is always possessive. They will tell their doctor, you have to make me all right. They are possessive. Where in case of phosphorus, we are seeing they are pleading. Phosphorus is thinking for everybody. Phosphorus is like an incense stick. Phosphorus is like an incense stick. And this arsenic in the last stage, they are completely different. Last stage of any disease. Suppose a cancer patient, we are seeing that there is no urge. It is like sepia, indifference. They become completely indifferent. They are not fastidious at all. That fastidiousness is disappear from them, and there is no fear, no anxiety about disease. They are simply lying. You see, you read the camps and you will get the idea. And there is a despair of recovery. Despair of recovery, and loss of interest in life. And lastly, there is a suicidal tendency at the end stage. The patient is telling, no way I should do suicide. मर जाते तो अच्छा था. So this is the arsenic album. So mental condition is very much important. Nowadays, everybody is telling arsenic album, arsenic album. I am giving you this simple way, the mental picture, because every now and then there are so many arsenic patients is coming in our clinic, and we have to make understand our mind whether this patient is arsenic one or other patient, because we are having so many drugs and that drugs is having different picture. Unless that picture of the patient is not matching with the picture of the drugs, then homeopathy does not work at all. Because picture of the patient and picture of the drugs should be similar one. Should be similar one. And this is homeopathy. Because when the frequency of the patient and frequency of the drugs resonance, then only we will get the result. This is the reason I was telling that we are giving arsenic to all the patients for corona prevention. Is it possible to work whether that patient is susceptible to the arsenic? Because arsenic patient we are getting, but it is not that much also. Because arsenic is a selfish remedy. Arsenic is a selfish remedy. He always thinks for himself, and after thinking himself, they thinks nearer one. Just understand homeopathy. Otherwise, it is very difficult to prescribe medicine to a patient. Okay, bye. Thank you.